Metformin does more than just lower blood sugar. Some side effects might surprise you. If you're taking metformin or thinking about it, you probably know it's great for managing blood sugar. But did you know it can also cause unexpected side effects, like taste changes or even respiratory issues? Metformin is one of the most prescribed medications for type 2 diabetes and prediabetes. It works by lowering glucose production in the liver, reducing sugar absorption in your gut, and improving how your body uses insulin. But like any medication, it's not without its challenges. Let's start with the most common issue: gastrointestinal symptoms. Nausea, vomiting, diarrhea, and abdominal discomfort often show up when starting metformin or increasing the dose. The reason? It irritates your stomach and intestines. To ease this, always take metformin with food and start with a low dose. If the discomfort sticks around, your doctor might suggest an extended release version. Diarrhea is especially common. It can start right away but usually fades over time. To manage it, eat with your meds and drink plenty of water to avoid dehydration. Other gut-related issues include bloating, stomach pain, or an upset stomach. These symptoms typically lessen, but in the meantime, switch to gentle, fiber-rich foods. Think oatmeal, bananas, and whole grains. Add probiotics like yogurt for gut support. And keep physical activity low impact. Walking, swimming, or yoga work well. Low blood sugar or hypoglycemia isn't a usual issue with metformin alone, but it can happen when combined with other diabetes meds or during fasting or intense workouts. To avoid it, eat regular meals and monitor your glucose levels closely. Always carry a quick sugar fix like juice or glucose tablets. Let's move to the lesser-known but still important neurological and systemic side effects. Some people report headaches or sweating. These can be linked to stress, dehydration, or changes in blood sugar. Stay hydrated, eat balanced meals, and exercise regularly. Mindful practices like yoga or meditation can also help keep symptoms under control. Then there's heartburn and dyspepsia. These symptoms may stem from increased stomach acid. You can tackle this by avoiding spicy, fried, or acidic foods. Go for smaller, more frequent meals and lean into alkaline foods like bananas or melons. A weird one? Taste changes. Metformin can leave a metallic or sour taste in your mouth. It's caused by the medication being excreted in your saliva. Chewing gum, eating fresh produce, or sipping herbal tea can help balance it out. Another surprising one is a higher risk of respiratory infections, especially in those with lung conditions. This is because metformin can slightly weaken immune response. Stay ahead by boosting your immunity. Think vitamin C and D, hydration, and healthy food choices. If symptoms linger, see your doctor. Even more unexpected is rhinitis. That's a runny or congested nose. It's believed to result from inflammation triggered by the medication. Omega-3 rich foods and plenty of fluids can help. Antihistamines or nasal sprays may offer relief. Metformin can also be linked to skin infections, especially in people with poorly controlled diabetes. High blood sugar weakens the immune system, making infections like cellulitis or foot ulcers more likely. To protect yourself, practice good hygiene, inspect your feet daily, and load up on skin-boosting vitamins like A and C. One serious but rare complication is lactic acidosis. This occurs when lactic acid builds up in the blood, usually in people with kidney or liver problems, heart disease, or alcohol use. Symptoms include nausea, vomiting, and rapid breathing. If you're at risk, your doctor should monitor your kidney and liver function closely. Staying hydrated and avoiding alcohol are simple but effective steps. Let's not forget about muscle and vitamin deficiencies. Some people experience muscle aches or weakness, a condition called myopathy. This might be linked to how metformin interacts with proteins in your muscles. To support your muscle health, eat magnesium-rich foods like leafy greens, nuts, and seeds, and stick to a regular exercise routine. Last but definitely not least, vitamin B12 deficiency. Metformin can lower your ability to absorb B12, which is essential for energy, red blood cell production, and nerve function. Symptoms include fatigue, numbness, or even depression. Get your B12 levels checked regularly and eat foods like lean meats, dairy, and fortified cereals. And let's not overlook that metformin, while generally safe and effective, works best when you're informed. Know what to expect, monitor your symptoms, and keep an open line of communication with your healthcare provider. Enjoying the insights so far? Subscribe to MedHeads for more evidence-based discussions, expert interviews, and content designed to keep you sharp and informed. That's it for today's episode. The MedHeads podcast is brought to you by Meducate.now. Thanks for listening.